Dr. Klaper, I really want to call you Michael because we've known each other for so long. I always found it curious that you grew up on a dairy farm.
Yes.
How did it happen to get from a dairy farm to believing strongly to devote your life to encouraging people to have a plant-based approach?
All right. Well, my early experience on my uncle's dairy farm was quite fortuitous, and I'm very grateful for it. It was an artifact of back in the 1950s. Every summer, the polio epidemics would sweep through the northern cities in the U.S., and my mother had an uncle who had a farm in Wisconsin, and so every summer, as soon as school was over, my brother and I would be swept up to the northern regions of Wisconsin, my uncle's dairy farm. And I spent my first 16 summers driving tractors and milking cows and slinging hay bales, and it introduced me to the natural world, and that my summers were filled with thunderstorms and hawks and eagles and animals, and I became very imbued with the principles of the way the natural world works, and that certainly, I think, became an influence in becoming a physician. So I have very fond memories of the farm, but also, even in my youth, I was aware that there was inherent animal suffering. I would see the chickens get their heads chopped off. I would see the most poignant memories was it was a dairy farm, and so when there was a male calf born, the calf would be taken away and put in the veal pen, and I can still hear the mother cow bellowing hour after hour. It'd go on for days, and I could hear the agony in her voice, and I knew there was something not right about the process, and I didn't quite understand how it all worked then. I was only 8 years old or so, but now it's certainly very clear to me. So I have very positive memories of the connection with the natural world I received from the dairy farm experience. But now, as I've become older and I've seen especially from the medical point of view, I see the physical effects of a meat-based diet, that cow's milk really is for baby calves, and when we consume it, it blows us up into great big overweight animals, which is what the substance is supposed to do, but for a baby calf, not for human beings. And I see the clogged arteries and the high blood pressure that comes from an animal-based diet that results in my devoting most of my waking hours trying to undo the damage that such a diet creates. That I look back to and say, I can see my life now in more entirety, and so I see there's no accidents, and I was given that experience for a reason, and it makes me more authoritative and passionate in my discussion about why dairy products really aren't intended for human beings, because I know the reality of how they're produced.
Some people feel that if they're using skim milk or low-fat this or low-fat that, if it has to do with dairy, that somehow that's okay. And we know that it's not, but why is that not okay?
That's a very, very important question. The reality is, if people can put down their attachments to ice cream and cheese and yogurt for a minute, the reality is, as I recently just implied, is that cow's milk is designed by nature to turn a 65-pound calf into a 400-pound cow in a year. That's what the stuff is for. The reality is cow's milk is baby calf growth fluid. That's what the stuff is. It's baby calf growth fluid. And everything in that white liquid is meant to turn a little calf into a great big cow. Everything, not just the fat, but all the proteins, all the hormones, all the growth factors, everything that mother cow can pack into that milk to make her baby's blood volume expand, to make the fat in the muscles increase. Everything in that fluid is made to produce a large bovine. That's reality. And so whether you take the fat off or not, all those proteins, all those growth factors, all those hormones are still in the milk, independent of the fat. And so whether you drink it as cow's milk, or whether you make ice cream out of it by adding sugar, or whether you ferment it into cheese, whether you ferment it into yogurt, no matter what you do with it, it's still baby calf growth fluid, with or without the fat. And as a result, people who consume it often are dismayed when they step on the scale or they get their blood pressure checked. Why is that? I can't seem to lose this weight. Well, look at the reality of what you're eating, and you'll see the answer there.
I've heard that animal protein can
Leach
leach
calcium
out of the bones. Is that,
Mm-hmm.
could you explain that a little bit better than I just
Right.
tried to?
Sure, fair enough. All right. Well, I have to concede the dairy industry has been really, really effective in linking their products and the calcium that's contained therein with the health of bones, and they have pretty much co-opted the whole osteoporosis issue here, and through some very simplistic imagery that bones are white, calcium is white. I mean, a piece of chalk is white, milk is white, has calcium, therefore drink this white liquid and you'll get nice, white, strong, healthy bones, you know, and they've made that connection for us. But from the physician's point of view, I know, all doctors know, that osteoporosis is not a disease of calcium deficiency. It's not a disease. People's bones are not dissolving because they're not consuming enough calcium. There's plenty of calcium in green vegetables, in nuts, seeds, grains. There's calcium all around. And in countries where they do not consume a lot of dairy products, you don't see more osteoporosis. In fact, you see less osteoporosis, you know, because the explanation we've been given is a gross oversimplification. Osteoporosis is not a disease of calcium deficiency. Osteoporosis is a disease of bone dissolution. The bone is a very complex tissue, and the bone matrix is dissolving. Okay, why? It's not from lack of calcium. It's from lack of using our bones every day. We used to be much more physical people. Now we spend all day sitting in front of computers. We don't carry things. That's the main reasons our bones dissolve. We assail our bones with a steady stream of substances that break up the bone matrix: caffeine, salt, sugar. Now, all these things injure the bone matrix and let calcium leak out into the bloodstream. And there's an issue of hormones. As women get older, their estrogen levels go down, testosterone levels go down. So just getting older may predispose you to this. But the major factor that actually causes bones to dissolve is lack of use and consuming substances that leach calcium out of the bones. So the real cure for osteoporosis is not drinking more cow's milk, is not taking calcium tablets. In fact, we find that's not a healthy thing to do. It's actually dangerous for a couple of reasons. When people just take handfuls of calcium tablets, again, in this mistaken belief that my bones are dissolving because I'm not getting enough calcium, which is wrong. That calcium goes to other places besides the bones. You wind up calcifying your arteries, you get calcium in your tendons, you get all this calcification in tissues that you don't want calcium depositing in. And regarding your question about protein, one of the things that contributes to calcium, to bone dissolution, is if you're consuming large amounts of protein, and this is in excessive amounts. But again, in the American diet, if you're eating T-bone steaks and going to the gym and knocking back these calcium, these protein powders, these huge amounts of protein, that's one more factor that actually contributes to bone dissolution, actually, from the acid load that all this protein presents to the bones. So again, we're in so much of modern life there, we get these little sound bites and that pass as knowledge, and it really isn't. And the dairy industry has been masterful in putting a calcium, bones, calcium strength, bone health, milk, you need dairy products. And the physiology certainly just does not support that. If you want to keep your bones strong, use them every day. Never miss a chance to walk upstairs, carry packages, put a little weighted vest on and go for a walk, a little hand weight in each hand, and that'll make your bones strong. And stop kidding yourself about coffee and alcohol and salt and sugar and all these things in our diet that really assault our bones. If you take those calcium thieves away and make your bones stronger every day, you don't need to be drinking the milk of a cow. And in fact, and it doesn't really help. When you look at the countries that consume the most dairy products, they have the worst incidence of osteoporosis. So prima facie, dairy products do not prevent osteoporosis.
B12 is always an issue. Most people know that vegans especially need to pop some B12 every now and then, even though it doesn't come directly from the animal.
Right.
The animal gets it from another
Bacteria.
source.
Vitamin B12, very important molecule, and we need it in order to produce healthy blood, to keep our keep our nerves functioning healthily, and actually for mental function. B12 deficiency can lead to a form of dementia. And I suspect a lot of folks sitting in nursing homes now with a diagnosis of Alzheimer's really have B12 deficiency. If you give them B12, I bet quite a number of them would perk right up. But that said, the question is, where do we get B12? We know it's important. The fact that vegans have to take a B12 supplement, people say, aha, see, it's an incomplete diet. You wouldn't have to take a supplement. But it's not a commentary on the deficiency of a plant-based diet so much as an artifact of our disconnection from the natural world. And by that I mean vitamin B12 is not made by cows or any animals. It's made by little bacteria that live in the soil, that lives in the waters. And when we used to live earth-connected lives, not that long ago, 100 years ago, when it came time to get drinking water, you'd go down to the stream and either lay down next to it and drink from the stream or get a bucket from it, or you'd go to the communal well and you'd pull out a bucket of well water, and there would be B12 in the stream water, be B12 in the well water. You'd go to, it's in soil bacteria that are on the surface of vegetables. You go into the garden, you'd pull up a carrot and you wipe it off on your pants leg and you eat it there, and you get B12 doing that. Well, nowadays we don't do that anymore. We chlorinate the drinking water so that it kills bacteria. Nobody drinks from communal wells anymore. All our vegetables are washed and scrubbed in chlorinated water. And so the vitamin B12 has pretty much just dropped out of our lives these days. And again, it's an artifact of how disconnected we've become. And it's for that reason that we need to take some supplemental vitamin B12 if you're not eating animal products. Now, let me just say that the cows don't make vitamin B12 either. Cows are eating grass all day, and they're pulling up clumps of grass that have B12 producing bacteria, and the soil particles cling to the roots. The cow swallows the bacteria, and in the cow's intestine, the bacteria multiply, produce their B12, and it goes into the cow's muscle. And when you kill the cow and eat the cow's muscle, yes, you're getting vitamin B12, but the cow did not make it. That is bacterial vitamin B12 that the cow just ingested. Well, it's much better to get the vitamin B12 from the bacteria directly, and nowadays those B12 producing organisms are produced and are grown in big vats. They produce their B12. The B12 is harvested off, and it's now made available in little tablets put under your tongue. But now they're adding vitamin B12 to soy milk, into veggie burgers, and there's lots of places to get B12 these days.
How much B12 should one have in a day?
Right, not very much. You need about 1,000 micrograms. A microgram is a millionth of a gram, and so folks without a gross B12 deficiency, I recommend they take something with that has 1,000 micrograms of B12 twice a week. But if you have a bona fide B12 deficiency, then you need to be taking some every day for a good couple of months to build your tissues back up. And then once you get normal values, then you can drop it again down to twice a week.
If you knew the next meal you had
Right.
was your last,
Right.
what would your wildest dreams be if it was also to be a little healthy?
Fascinating question for a number of reasons, because what it does really is it gets to the heart of that dilemma that every one of us faces at every meal. There's what our little taste demon would really like to have. We'd all like to have chocolate cake for breakfast or whatever. And then there's the health ogre that says you really ought to be eating more vegetables. And so every food choice you make is always basically a little mini battle between those two forces here. And now you've now focused it into large, writ large crystal vision here. So what would I do there? I'm at a stage in my nutritional evolution where I enjoy the food I eat so much that I wouldn't mind having healthy stuff for my last meal. It's funny, playing off of your comment about being gruesome, I saw they were doing an execution by lethal injection at a prison, and before they put the needle in, they took the alcohol and wiped off the skin before they put the needle in. And I'm looking at that act, and I'm saying, what is this for? To prevent infection in a day or two. It's a little bit smacks of a similar thing here, the ultimate futility in terms of eating a healthy meal for your last meal here. I might as well let it rip, right? So I would probably go to the cherry pie side of those things if it truly was my last meal. But that said, and getting back to your original, what do I really eat? In the morning, I have a big bowl of fruit. I cut up watermelon and cantaloupe and mango and grapes and most any fruit that I enjoy. I put it in the fruit bowl and I have a little bit of oatmeal with it. That is so flavorful. It is just a riot of textures and tastes on my tongue to start the morning off with. That boy, I wouldn't mind that for my last meal either. It is just so delicious. And for my later meals, I have basically salads and hearty vegetable soups and big plates of steamed greens, and a big helping of kale with lemon juice squeezed over it, and some quinoa on the side. Boy, I wouldn't mind that for last meal either. And it really is what I enjoy eating. And I'm a big fan of really hearty vegetable soups, and bean and barley soups, and mushrooms, and all sorts of wonderful hearty soups, and that wouldn't be too shabby either. So, and yeah, I'd probably have some cherry pie for dessert. I guess my last transgression is there. But kidding aside, my diet it's been a series of evolutionary steps, and when I first became a vegan 30 years ago, and mostly for reasons of compassion and ethics and wanting to reduce the violence in my life, as well as help my arteries stay clean. Back then, and this was back in the 80s, all I knew to do was substitute spaghetti for steak, and it worked, but I realize now, looking back, there's a huge amount of white flour, starchy food plates on the plate there with some sauce over it. And in recent years, I've pretty much evolved past it. I don't eat much in the way of pastas anymore, and breads anymore, and white flour products pretty much have dropped out of my daily fare here. So again, I have fruit and oatmeal for breakfast, and lunches and dinners are basically the same. I have three components that all start with S: salads and soups and steamed greens. I have a big salad every day, twice a day if I can. A hearty bowl of vegetable soup, big plate of steamed greens with a little bit of quinoa on the side there. And when I say steamed greens, I'm talking about kale, collards, broccoli, Swiss chard, bok choy. If it's emerald green, I steam it and eat it. I just love that. And
what about seasonings?
I'm a big fan, as I mentioned. I squeeze lemon juice on my greens. There's these lovely flavored vinegars, and rice vinegars, and raspberry fig vinegars, all these wonderful vinegars I use. And there's some products around. There's one called Table's Tasty. It's just delicious to sprinkle on vegetables. So I'm a big fan of...
so moderate salt is all right?
The salt issue is a very controversial one. If you have bona fide high blood pressure, and it's a real issue, you probably should not be consuming significant amounts of salt. All the sodium that you need. I mean, sodium is not evil. When they say salt, that's sodium chloride. It's the sodium that causes the high blood pressure. Sodium's not evil. We need it to keep the electrical function of our cells going and all that. But it's already in the vegetables. Every cell of a carrot or piece of Brussels sprout has sodium in it. We get all that we need in the food. We don't have to add more of it. Now you can add a little bit. Keep it to less than half a teaspoon a day, and I think you'll be fine. But most Americans eat a teaspoon or more a day, sometimes 2 and 3 teaspoons. And because the salt is already in the packaged food. And when you open up a box or of a soup mix, or you open up a can of a soup, or you go to a restaurant, the salt has already been added. Therefore, you don't even taste it. But the huge amounts of sodium that most Americans eat are coming from the processed foods and the restaurant meals. The food that you add at the table, that's the least of the issues, actually. In general, the rule of thumb is you want 1 milligram of sodium for every 1 calorie. In a serving. So if the serving of whatever the food is has 100 calories, there should be 100 milligrams of sodium.
Okay.
And if you just extrapolate that out, if most people eat, say, a 2,000 calorie diet, that's 2,000 milligrams of sodium, and which is about a half a teaspoon. And that if you keep it in that range, you're not going to have any problems. But most Americans eat 5,000, 10,000 milligrams of sodium a day.
Yeah. You've had hundreds of thousands of patients over your career. Can you look back over and think of a patient that stands out so much in your mind, where simply shifting what they put on their fork saved their life.
Oh, legions of faces go by in response to that question. I don't take before and after pictures of patients, but there's a lot of times I wish I did, because the transformation is so remarkable. You know, he becomes a composite. Early in my career, the patient, when I just started into general practice, the patient I used to dread coming through the door would be a middle-aged man, in early 50s, 50 pounds overweight, high blood pressure, diabetes, gout, and I never really knew what to tell him. I fiddled with his blood pressure medication, and let's try this diabetes medicine, and here's some allopurinol for your gout, and you really ought to lose some weight, Joe. And I didn't know what to tell him, and they would leave unsatisfied, and I knew that call would come from his wife. He'd just been admitted to the ER, and he's got chest pain, and I really knew I was not serving these people at all. After I became aware of plant-based nutrition and adopted it for myself and watched 40 pounds of fat melt off my body and my blood pressure come down and my cholesterol come down, I knew what to tell my patients. And so I began sending them. I had friends who were excellent vegan chefs, and I would send my patients off to them for cooking lessons and outline, here's what they have for breakfast, lunch, and dinner. The transformation was just stunning, and with apologies to the female viewers of this tape, men lose weight quicker than women. I will get a couple in my practice, a man and a woman, and they both adopt the same diet, and the guy will lose 30 pounds in a month, and the woman's lost 2, which she's all upset about it, but the drawbacks of having estrogens, I guess. Thank God for estrogens. We wouldn't be here without them. But that said, what I'm implying is that men especially, but women, eventually, of course, it works for women as well, but men make these dramatic changes, and they come back a month later if they're able to maintain their diet, and they've lost 20 pounds. Their blood pressure's down. Their joints have stopped hurting them. Their blood sugars are now manageable. It's just dramatic what I've seen. And so in answer to your question, he'd be an archetypal guy in his 40s or 50s or 60s, overweight, hypertensive, diabetic, and predictably, you put a $100 bill on the table, how much better he's going to feel if he's able to maintain this, and you never lose that bet. It's just dramatic. But the women as well. I've seen women with who've had these fibroid tumors. Again, I'm amazed how much of my medical education I was so credulous that there would be all these conditions: diabetes, high blood pressure, unknown origin, etiology unknown, genetic, idiopathic, and really the reality is it's the food they're eating is the real answer. And some of these conditions where you wouldn't think it would have a connection. Well, what does uterine fibroids have to do with food? They're benign tumors of muscle in the woman's uterus. Well, our diet is so loaded with fat that turns into hormones, plus they give hormones to the chickens and to the cows, and you're eating dairy products. This is an animal that's recently just had a baby. That milk is loaded with hormones, and women are drinking it to keep their bones strong, right? And so their poor uteruses are subjected to this tremendous hormonal drive, and no wonder they start sprouting out these muscle tumors. Well, you get them on a diet that pulls that fat out, pulls those hormones out, and you watch uterine fibroids get better, and their heavy periods stop, and they cancel their hysterectomy surgery. It's hard not to get into hyperbole here, but
Right.
it's these conditions that we're supposed to only yield to a surgical blade. They yield to better eating, and wow, what a powerful tool that is.
What is your hope for the future?
My hope lies, of course, in education. My hope lies in the big aha, that what were we thinking, and there's so many, history is so rich in those type of examples. I'm hoping that especially our young people get so they're getting so savvy these days. I hope they catch on to the fact they've been deceived and they've been pandered to as far as we see this tsunami of childhood obesity bearing down on us. Our kids have been so grossly overnourished, quotes around nourished, over calorized, that in the same way that that knowledge has spread through the internet, that has spawned these political revolutions and these economic revolutions, I'm hoping there's a nutritional revolution, and I'm seeing threads of it on the internet, that they're saying, wait a minute, this diet is not healthy, this is killing us, and it becomes hip to eat fruits and vegetables, and it becomes hip to be a lean, active young person. That's how it will unfold. What will start that? Starts with the parents, starts with the example you set for your child. Gandhi said, example is not the best way to teach. Example is the only way to teach. And what your kids see mom and dad putting in their mouth, what mom brings home from the grocery store, the foods that are ordered in restaurants, sets that example. So it's not a matter of just hopefully the kids will wake up one day. We've got to lead the way for them. So as this nutritional awareness dawns throughout society, which is happening in the media and on the internet and through works like yours, I'm hoping there's just a general awakening in all the generations. The adults buying the food start getting healthier and wiser in their choices, and that will spawn a whole new generation of kids who just grow up healthy and knowing what to eat.
I really especially am grateful you were willing to do this, and I know it's going to help a lot of people. Thank you.
You bet. Well done.